So till now, we have discussed about how non-linear ulcers start and what are the causes of non-linear ulcer. So if I come to the treatment option, what are the treatment options available nowadays and what are they?
So basically, our treatment of a non-healing ulcer will depend on what kind of ulcer we are dealing with, whether it is an arterial ulcer or a venous ulcer.
Right.
Accordingly, we will come to know the pathology behind it and the treatment will be directed towards it.
Okay.
For example, it is an arterial pathology because of diabetes. Control the diabetes, take the medicine to keep the blood thin like ecosprin, clopidogrel, and nowadays we are using a Xarelto like a rivaroxaban. We are using newer anticoagulants like the Xarelto Novax, which we call as.
These are medicines.
These are medicine which will keep the blood thin and it will allow and push the blood into microvascular circulation.
But these medicines,
Number one.
viewers should not use directly until they'll consult the doctor.
Of course, because we have to find out whether it is arterial ulcer or a venous ulcer, and then if it is an arterial ulcer, what is appropriate.
Yes.
Let the doctor decide about it.
Yes.
So this podcast is about spreading knowledge, not to self-treat yourself.
Yes.
All right. And then the second group of drugs that we are using is celostazole, which will improve the microvascular circulation in a case of a arterial ulcer. And then, of course, we have like Trental and the other medications which can improve the blood flow into the distal circulation.
Okay.
That is the first part. Control diabetes, improve the blood circulation.
Yes.
Third group we use is an anti-cholesterol like rosuvastatin or atorvastatin, which will improve the atherosclerotic plaques in the leg, hence the blood flow improves.
Okay.
Once that happens and patient is fine, we are happy. Control diabetes and give medication for prevention and treatment.
Okay.
If the disease has progressed further than this, suppose a patient is already having a pre-gangrenous change, we cannot do that. We have to immediately address.
Okay.
How do we do that? Basically, we have to improve the blood supply by doing open surgery called a kind of revascularization or bypass. But nowadays, what we do is an angioplasty of the leg vessels. So the angioplasty means we make a small puncture in the groin blood vessel. We go with a wire and balloon and do angioplasty and improve the blood supply to all the way to the distal foot. So we can do a SF angioplasty, which is the blood vessel superficial femoral artery in the leg, or a popliteal angioplasty, which is a popliteal artery behind the knee joint, or below the knee joint arteries like anterior tibial artery, posterior tibial artery, peroneal artery. And of course, we can go to the foot and improve the dorsalis pedis blood supply. We call it as a plantar arch angioplasty. So these are the angioplasties at different regions of the leg, which we can do to improve the circulation.
Yes, right.
So this is for the arterial side. Coming to the venous side, a non-healing ulcer of the leg because of venous problem like varicose vein. What do you do? Basically, we give compression stocking. We ask the patient to avoid prolonged standing and some medications like flavonoids. We have Daflon, we have Oxidute, we have Aldospin. Different type of flavonoids are there which we can give, which improve the venous return from the leg. And so compression stocking, then additive medicine, avoid prolonged standing. If you're obese, then try to reduce weight and a regular exercise targeting the calf so that your legs are strong. So once you do that, then definitely these ulcers will start improving. But in case we have a patient with ulcers are not healing, then we go for a specific therapy of varicose vein, which in form of laser treatment or endovenous laser ablation, or a radiofrequency ablation, or a super glue embolization. Now we have VenaSeal and VenaBlock. These are the glues that we are using for last about 3 years with excellent result. So these are the three modalities: the laser, the radiofrequency, and the super glue like a VenaBlock and VenaSeal. So these are the things that we do to treat varicose vein. Okay. Now suppose the patient has a DVT, deep vein thrombosis. After some time, the patient has a post-thrombotic syndrome or PTS and the ulcer is not healing, then we do a venogram. If there is an occlusion or stenosis of the common iliac vein, deep veins, we do angioplasty and we improve the blood supply. That helps the leg size become smaller and the ulcers start healing. The post-traumatic syndrome gets improved. So these are the different type of treatment we do. But start with very preventive way. If it is an arterial ulcer, stop smoking. If it is because of smoking, control your diabetes if that is the cause. And for cholesterol, anti-cholesterol medicine, if it is a thromboembolic problem, address that. But most of the thromboembolic problem needs immediate attention in terms of taking out the thrombus by a Fogarty or by a aspiration. Now we've got a lot of mechanical thrombectomy system for peripheral arterial disease like Penumbra and other systems which can suck out the clot from the leg blood vessel. They can be used.
Sir, can non-healing ulcers be treated by antibiotic or creams, certain creams?
Definitely. If you have a non-healing ulcer which is because of some kind of infection, which is rare, you can probably treat by antibiotic and some creams. But if the deep-seated problem is an arterial problem or venous problem, which happens in most of the cases, it is impossible to treat with antibiotic.
Yes.
But yes, they can help the treatment of non-healing ulcer when addressed and adjuncted with the real definite treatment of arterial or venous pathology. So treat your arterial venous pathology alongside antibiotic and cream will give you the result.
Yes.
Only antibiotic cream, no result or a temporary relief.
Okay.
Whatever medications that I have mentioned here should not be taken directly. If you have a problem, please consult your doctor. After your consultation of your doctor, you can take any kind of medicine. Just listening here on the podcast about some medications, please don't start such medicines.
Thank you, sir. Actually, here in this podcast only, we just want to add some value, add some knowledge, healthcare knowledge to our viewers or the patient, those who are suffering with certain kind of diseases. But directly with watching these videos, it will directly go through the certain medication that will not that medication will not be helpful, and that maybe it can issue another issues for you. So please avoid that one. Before that, you visit your doctor, nearby doctor, and consult them. As per their advice, you take your medicine. Sir, I have seen so many patients, those who are suffering with non-healing ulcers, and they goes to the doctor regarding debridement of the wound. So what is debridement and how it helps to heal the wound?
So basically, you see, if you have an ulcer which is a large one and non-healing, so there will be pus, dead tissue, and other necrotic areas over the wound.
Okay.
So once you have this dead tissue, which is otherwise called necrotic tissue and pus and all, the healing will be impaired. In debridement, what is done is you remove all the dead tissues. So you create a raw surface with a good blood supply there, so that the granulation and subsequent healing is better. So in plain word, debridement is a deep cleaning of the wound, taking out all the dead areas, making the surface raw so that the granulation and healing will be faster.
Okay. When it is really required, we have to go for the debridement.
Yes.
And the healing will be faster.
Yes.
Sir, if a non-healing ulcer is there, on that case, you basically recommend medicines as well as offloading sandals or shoes. So offloading footwear will be helpful for the patients?
Oh yes.
And why?
Yes. We have already discussed about it. When a patient is suffering from a neuropathy, that is damage of the nerve in the foot, so it can happen because of diabetes, leprosy, and other causes. So once there is a neuropathy, the patient is not able to feel the pain. So I put my hand on the table, I feel some sensation. If I don't have the sensation, how hard I place my hand, I will not know.
Yes.
All right. So if I put my hand on a very hot surface, I will also not know that it is a hot surface, but my tissue will be burning. If I put it on a needle, I will not feel the pain, but I will start bleeding.
Yes.
So the protective phenomena that is called pain is gone when a patient is suffering from neuropathy.
Yes.
So an ulcer is formed. So definitely for healing of this ulcer, we need to offload them. Offload means we will see that no pressure of the body or the body weight is on their ulcers, so that they have a clean, airy surface without weight, that will improve healing. Yes, offloading helps in neuropathic ulcers in the foot.
Only neuropathic or diabetic ulcers, diabetic condition?
Diabetic patients have ulcer because of arteriopathy or neuropathy or a mixture.
Yes.
So mostly they will be helped.
Okay.
If you really want whether this patient will be helped or not, you do an angiogram to find out the blood supply. You do a nerve conduction study to understand the nerve conduction of this part. Suppose the nerve conduction study is absolutely normal.
Okay.
Patient is having an ulcer with an occlusion of, let's say, popliteal artery, ATPT. So offloading is not required. Here what you require is to recanalize the blood vessel. But generally you get such cases in diabetes are very rare, because by the time the arteries has become very bad, the nerves will also become very bad or at least bad. So offloading almost always helps in diabetic patients.
Thank you, sir. Sir, how does compression therapy helps in non-linear ulcers? How?
As we said, that if there is an ulcer because of a venous pathology, why it happens? Pure blood is coming to the leg, impure blood is not able to go up.
Yes.
Dan Gurunchi, you got this non-healing ulcer in the venous pathology. So when the impure blood is not able to go up and there is a venous blood pooling in the leg, you will have an ulcer.
Yes.
Now why that happens? That happens because in the vein we have non-return valve or one-way valve placed at different places at the level of perforator, at the level of junction between superficial and deep vein, like saphenofemoral junction, like saphenopopliteal junction. At various places there are valves in the venous system of the legs,
Okay.
which allow the impure blood to go up in one direction. The other direction flow is not allowed because there are unilateral one-way valves there.
Yes.
Now suppose for a person who is standing for long hours or pregnancy or whatever the reason for a venous disease like a varicose vein we have explained, what will happen? This valve become weak. And once this one-way valve become weak, it is like you have taken out the traffic police from a one-way traffic. What will happen?
Okay.
People will come from this direction, A to B, and also some will go from B to A. So there is a chaotic situation.
Yes.
That's how when a patient is having a venous disease, you have the venous blood coming from up to down and down to up.
Yes.
And you know, because of gravitation, it is easy for the blood to go from up to down. Hence, venous pooling in these patients because of damage of the non-return valve in the vein.
Okay.
What you need to do? You need to improve the possibility of the calf,
Yes.
because calf is known as a peripheral heart. Like the heart is pumping good blood, pure blood, arterial blood from the heart, from the chest to all part of the body. Like that, the calf muscles of the leg are called peripheral heart because they are responsible for pushing the impure blood from the leg up.
Okay.
So to improve them, exercise I told you, tiptoe exercise, supine cycling exercise and squatting. But think of an 80-year-old man. He cannot do all this exercise. So what else we can do? We can give compression therapy. If you put on a stocking, we have class 1, class 2, class 3 stockings. Class 1 stocking is a less pressure where it is used for a DVT patient. Class 2 is more, that is about 20-25 millimeter of mercury where you can use it for a varicose vein
Yes.
treatment. And 30 plus is a class 3 stockings which can be used for a ulcer healing,
Yes.
which is called ulcer kit. So compression therapy will definitely help you if you have varicose vein or a venous ulcer.
Yes.
Because compressing the calf from outside is definitely going to help because your calf is not doing a right job at this point of time because of varicose vein.
Understood, sir. These are the non-surgery management what you told till now. So, in the non-healing ulcers, surgery is required. We go for surgery or surgery is not required.
Absolutely, that's a good question. So now if a patient is having non-healing ulcer, I told that we will first find out the cause. Is it an arterial cause? Is it a venous cause or is it otherwise? So for arterial cause, if there is a vessel occlusion, you start with your medication. Subsequently, if that is not helping and the vessel occlusion is longer, larger and extensive, you do angioplasty, put a stent, open up the blood vessel, or you do a open surgery and do a bypass. So these are the surgery available for improving the blood supply in a patient who is having non-healing ulcer because of arterial pathology. And at the same time, as you have discussed, debridement if required for an ulcer which is having pus or necrotic tissue, so those debridement can be used. And also you have suggested that offloading.
Yes.
So for an arterial ulcer, you start with your diabetic medicine, stop your smoking, take your anti-cholesterol medicine, and see that you don't have thrombus here and there, which can be a thromboembolic complication of the lower limb blood vessel. That is one. Second, if you have gone to a stage of ulcer which is beyond that, start with your medications. And then if that is also not healing, then definitely simultaneously improving the blood supply by angioplasty stenting or a bypass surgery, and side by side taking care of the wound by debridement offloading. That will help healing the arterial ulcer.
Okay.
As far as venous ulcer is concerned, again, if the diagnosis is a venous ulcer, we know that the ulcer will be above the foot most of the time or dorsal surface, never a plantar surface or never the toes.
Yes.
And there you can start your medication like flavonoids as we discussed, and you can do your compression therapy like class 1, 2, 3 stockings we have talked about.
Yes.
4-layer bandage is also one form of therapy. The pneumatic compression is one form of therapy. Depending on the doctor's advice that you are attending, you can do 1, 2, 3 class compression stockings, or you can do a pneumatic compression, you can do a 4-layer bandage. And if the disease has progressed beyond that, let us treat this varicose vein by either RF ablation, laser ablation, or the glue embolization.
Okay.
And if it is a DVT, again I told you that DVT will not cause ulcer, but DVT subsequently will lead to PTS, post-thrombotic syndrome, which can give rise to swollen leg and ulcer which is not healing.
Okay.
In that case, you do a venogram, find out the deep vein system and see that there is a blockage or stenosis, try to address them, do angioplasty, open up the blood vessel, and at the same time do a pneumatic compression if required, class 1, 2, 3 compression, especially for ulcer, class 3, for varicose vein 2, for a DVT 1, acute DVT. So follow that protocol, do your compression therapy and address the flow in the deep venous system. If the deep venous flow is very good, you have created a beautiful deep venous flow by angioplasty stenting, you can additionally treat the secondary varicose veins in a patient of DVT who is having PTS. Varicose vein can be of two types, the primary varicose vein, secondary varicose vein. Primary varicose vein, the cause is not known.
Yes.
You are standing, you are having a familiar history, you can have varicose vein. Secondary is due to a pathology in the body, you have varicose vein.
What kind of pathology?
Like deep vein thrombosis. Today, patient is having deep vein thrombosis. If it is not treated well, subsequently patient will develop secondary varicose vein, secondary to DVT.
Okay.
So it is a secondary varicose vein I talked about because of DVT.
Okay.
And then again, this kind of swelling of the leg we see in case of CS cervix patient who has undergone radiation.
Okay.
But that is not related to the venous system, that is a lymphatic system. We can call it as a lymphedema.
Lymphedema.
So it is a lymphedema. Again, the compression therapy will help that, but it is not an ulcer. That's a different topic altogether. So post-thrombotic syndrome because of DVT leading to secondary varicose vein.
Okay.
All right. So this is how we have to address the different type of ulcer as far as treatment is concerned.
Sir, just now I have a small doubt. What is lymphedema and what is varicose issues? Is there any?
Yes. So that's a very good question, which is like very commonly, misunderstood.
Yes.
So any type of swelling, people think I have filaria. Many patients, they will come that I have filaria.
Mm-hmm.
So filaria is something people think that it is swelling of the leg is filaria. First of all, that is not correct. Swelling of the leg is swelling of the leg. It can happen because of variety of causes. As we have discussed, there is arterial system which brings the pure blood to the leg. There is a venous system which takes the impure blood from the leg. There is a lymphatic system which takes the lymph, the clear fluid. You see, sometimes you get hurt, blood comes, slowly the blood stops, some clear fluid comes. That is lymphs.
Okay.
So this lymphatic system has also a similar system like vein which takes the lymphatic from the leg upwards. Suppose we block the lymphatic system, if the lymph cannot go from the leg up, the leg will be swollen up. That's why it is called lymphedema. Edema caused because of the lymph is called
Lymphedema.
lymphedema. Why it is caused? Common cause is filaria. How it happens? The filarial infection, microfilaria, will go to the lymph node at the level of the groin. They will damage those lymph nodes who are responsible for bringing the lymph from the leg upward. Once they are damaged, the lymph nodes cannot be drained. So patient will have lymphedema.
Okay.
First. Second, if there is a radiation to the groin for whatever reason, most common is a gynecological cancer, CA cancer, endometrial cancer, ovarian cancer, who will undergo radiation at this level. The radiation can cause damage to the lymph nodes, so patient can have lymphedema. We are commonly seeing that patient who are having breast cancer. Suppose after surgery the radiation is not done well and that has damaged the axillary, they will have a lymphedema.
Lymphedema, yes.
Okay.
Yes.
So lymphedema is edema because of lymphatic blockage, which can happen commonly because of filariasis. Second is because of radiation.
Sir, on this lymphedema case, patient has to wear the compression stockings for lifelong?
Yes. We do not have a good therapy for lymphedema right now.
Okay.
We are trying to see whether we can bypass, we can put a drainage from the leg, bypassing the groin lymph node, but that is in the research stage. So we don't have a great solution right now. Present recommendation is lifelong compression stockings.
Compression stockings. That too, depending upon the requirement of how many, grade 1, grade 2, grade 3, I think. In that case.
We need, because lymphedemas are already most of the time they are solid.
Okay.
So we need a good compression of 30 to 40. So we use a grade 3.
Grade 3. Sir, what are the common misconceptions about the non-healing ulcers?
First misconception, I have seen patients who are having non-healing ulcer and long-term diabetes. They think ulcer means we have to remove the leg. I am saying that you don't have to go for an amputation or remove the leg. We try to revascularize, recanalize your occluded vessel, give you a good blood circulation and save the limb.
Yes.
Diabetic foot doesn't mean that you have to go for amputation all the time. You should evaluate and you should treat. Then there is a possibility that you can have your legs for life. Number one.
Okay.
Number two misconception, people think that if there is a non-healing ulcer, taking a lot of antibiotic will also heal the ulcer. That is not true. Let us find out what is the cause, if it is an arterial, venous or other cause, and address the cause and treat the ulcer. That will heal. Taking antibiotic is no solution for treating a non-healing ulcer.
Okay.
Number three, most of the people, they will come to me, they will ask whether this venous ulcer can lead to cancer. They do not. 99.9% of your ulcer on the leg because of arterial or venous problem will not lead to cancer. Especially the venous ulcer stays for a long time. I have seen patient who has non-healing ulcer of the leg for 27 years. Okay. So the gentleman who was about say 70 years is having an ulcer since 42, 43 years of his life. 27 years of ulcer. So venous ulcer can stay longer, but they don't proceed or progress into cancer. One misconception people have that this ulcer can lead to cancer. No. They generally don't go to cancer.
Arterial ulcer?
Arterial ulcer, you cannot bear with them for more than a couple of weeks.
Yes.
You have to either go for amputation or you have to treat them or somehow something.
Yes. Sir, as we have discussed so many things, and let's come to the recovery part. So, sir, how much time it will take to recover a non-healing ulcer? And for that, after recovery or after surgery, what are the aftercare each patient is required?
Depending on the kind of non-healing ulcer we are dealing, the recovery will vary. For example, you are dealing with an arterial ulcer because of diabetes or smoking, Burgess disease and atherosclerosis. So once you have done a great revascularization, it takes about 2 to 3 months for a complete healing of the ulcer. Without any kind of skin grafting or plastic surgery, it will automatically heal because of a good blood supply and your regular dressing and ointments and adjunct medicine. So I would say 2 to 3 months depending on the size. The largest size of ulcer will take about 3 months.
3 months.
The smallest can be just healed in 15 to 20 days.
Okay.
And for the venous ulcer, again it takes about 4 to 6 weeks after the treatment of the primary venous pathology. with compression, adjunct therapy, and the treatment of the primary disease like varicose vein or PTS, it takes about 4 to 6 weeks for healing of the ulcer. And as far as the care is concerned, obviously we have to take care of our diabetic status, the vascular compromise status, the venous pathologies, and of course, the compression stockings for the venous pathologies, and avoid prolonged standing, maintain body weight, do regular exercise.
Yes.
They are going to help you for maintaining, improving your ulcer healing, and getting to the complete recovery as fast as possible.
Thank you, sir. Today we have I have acquired knowledge, so many knowledge we have acquired regarding non-healing ulcers. But in non-healing ulcers, what is your basic advice a patient, a common man should follow?
Common men should follow that we should not have an ulcer. You should not have an ulcer means you should not have diabetes, you should not be smoking, you should not be having atherosclerosis. At least the avoidable, preventable causes should be avoided. That is my advice. Second, avoid prolonged standing or sitting. Like in this podcast, you see, within the podcast, we have spoken of about a couple of times. We have just walked around here and there. So by nature, you should be a person who doesn't stand or sit for long hours. Changing posture will help.
Yes.
If you have to stand or sit for long hours without a break, I would suggest to wear stockings, maintain ideal body weight, do some exercise, yoga, pranayama will help. And of course, ideal body weight management, less of stress are very, very important to maintain a good health where your vascular health is maintained well so that your prevention is on your hand.
Okay. Thank you, sir.
Thank
so, in this podcast, we came to know so many things and about non-healing ulcers, how it, what are the causes, and how it affects. And finally, we came to know what are the recovery things, how we'll get the proper recovery, and to whom we should consult. So many things. Sir, thank you. Thank you for
Thank you
joining
so
our
much.
podcast.
It was such a wonderful time that I spent with you and your team. So I am very, very happy that you are propagating knowledge among the public. So I wish you all the best. And
Thank
I'm
you,
so thankful that I had the opportunity to see you and talk to you.
Thank you, sir.
Thank you. Namaskaram.